First of all, I'm glad to get the opportunity and want to thank Deputy McGrath and his staff for putting this very important motion together. At the outset, I want to convey my deepest sympathy to Michael Lynch, who lost his life tragically in the last few days, who is a nephew of Michael Collins, a member of our group, and to his brother Danny Collins, Councillor Danny Collins, and to Michael Lynch's mother. And we pass our condolences and sincerely wish him strength and that God will assist him in this very difficult time that they are encountering. This motion is basically about GPs, and the lack of GPs, and the service that's that people can get a satisfactory service in relation to GPs at the present time. Elderly people can't get appointments. Families and locals even returning to Kerry and many areas around Kerry, including Killarney, can't, no GP can take them on because they're so overstretched. And we have to remember, Minister, that talk about Killarney, there's up to 5,000 new people with medical cards now placed in Killarney, and these people have medical cards, and the doctors have to take on so many of them, and that's putting the service, a severe strain on the service. I have had many cases of people even returning that can't get a doctor to take them on. Ambulance delays when the doctor is under pressure, and I know about a case where a little baby stopped breathing, 3 months old, and the doctor couldn't attend. And the doctor did the next best thing, ordained an ambulance. It took an hour and a half for the ambulance to come, and that's not satisfactory. I mean, a young life could be lost, and it was only by the grace of God that that child is still alive. That's serious stuff. And you see, the reconfiguration of the ambulance service back in 2012, what it has meant to local rural areas is a reduction in the service. The word they used that time was reconfiguration. What it has meant is a reduction in the service. Then we have families, and when the person is taken into the General Hospital in Tralee, again they have to wait many hours for doctors there. And I had a call from a family whose mom was taken in there in the last few days, and the doctor took many hours before the doctor could attend to this elderly lady, and many hours on a trolley before she actually got a bed. And then one of the sons rings me again yesterday that the family have been advised by the hospital that some family member must come in to feed their mother and to attend to the tablets and stuff that she needs to take. And it brings it very home to me, very real, that there's a lack of medics, nurses and staff in Tralee General Hospital when this is happening. And God help us if we go back a couple of years when family members weren't allowed to go in to feed their people during COVID and left them we'll say seriously in compromise without being fed properly. And that was very wrong. That was a dark hour in our history when family members couldn't go in to visit their elderly people in the last days of their lives. And then when they became unconscious, everyone was left in. So we have a serious problem in rural areas to get a GP service. And I want to especially thank Gary Stack and Southdock, which was set up that time. And I know that my father, the late Father Danny Healy-Rae, worked very hard with Gary Stack and others to provide that out-of-hour service. But we don't have enough GPs in that service now. And you know, Minister, from Friday evening till Monday morning is a very long time if we get sick, and people can't organise that they won't get sick during those hours. And because people do. And gone is the day when the doctor, whether it was Dr. O'Callaghan or Dr. Boland, would come to the house to the elderly person or whoever was sick. That's long gone. And we depend on Southdock, but we need that service to be enhanced, because they start out in Killarney on one side and they have to travel all the ways through Kilgarvan, through Kimere, back to the county bounds in Loughrock, and down through Timpernoe and Blackwater as far as Sneem, and over Malls Gap down into Killarney. Massive distances, and they're under savage pressure to see after people. And we do need more GPs, and like has been said already, they're the first point of contact for any one family member who has someone sick or some elderly person their own who's sick and needs a doctor. And sometimes it's even desperate hard to talk to a doctor, to get the doctor on the phone, because they're so busy. And families, as I said, have been advised to come in to feed their elderly people in the hospital. That shows how much understaffed the hospital is. And you see, like, there's so much money going into the HSE, but we still don't have a proper service. And when I see all the people that are going around out in the country every morning early, working hard and paying their taxes, that's one of the things that their taxes are for. And I don't believe that they're getting they're not getting the rewards for the taxes that they're paying in this regard. The rural healthcare crisis extends to the emergency and dental care provision, where children are forced to wait up to 10 years for treatment, and less than half of eligible children were seen under the school screening program last year. This is terribly serious, because when children, if they outgrow the time for doing the treatment, their mouths may not be perfect anymore, and it's the one chance. We should be doing a lot more there. The rural healthcare crisis is further exacerbated by a severe shortage of home helps, a worsening crisis in every accident and emergency department, and also non-existent mental health care service, and a severe lack of residential places for people with physical and mental disabilities. Too often I've heard the story, we tried to get a place for our son or our daughter, and I have met those people, and I feel very hurt when I'm at the door, maybe looking for a vote, and they tell me what happened. They tried to get their child kept in a residential big place because they were worried, and when it didn't happen, and as much as they minded and tried, because people do know when a youngster is in trouble, they couldn't get the proper care for them, and they lost them. And that's a sad reflection of our healthcare system. Look, I'm calling the government to explain how, despite an increased national health budget, the country is witnessing a steady deterioration of our health services, and especially in the rural communities. If all things were equal, we still need more doctors to travel the expansive and extensive areas that they have to cover in rural places like the Oireachtas Peninsula, the Dingle Peninsula, and the Beara Peninsula, going back on the south side of Kenmare Bay. We need more GP services, Minister, and I'm appealing.